Hi, it's Dr. Keith McAfee. Welcome back. This is Medicine and Faith, where I take a subject of medicine and relate that to our faith. Today, actually something that a lot of people suffer from, plantar fasciitis. Plantar means bottom of the foot. Fasciitis, fascia is that connective tissue layer we have in our in-between skin and muscle, or skin and bone. There's that connective tissue with all the stuff of the body. Fascia is one of those layers. It's a very thin layer. It's like canvas. It's very strong. And itis means inflammation. All right, now I am going to attempt, despite my general lack of abilities, to draw a foot. Ooh, that's not so bad. Ha! I'm proud of myself. Okay, so here you have the bones of the foot, and the heel bone kind of comes down at an angle like that. It's called the calcaneus, that's the heel. And then you've got several other bones, and then you've got the long bones of the midfoot, called the metatarsals. And then you've got the, I didn't put it quite this right way, but you've got the toes of the bones of the toes. And notice that they make an arch, okay? That's the natural arch of the foot. If here you have the ground, sorry I didn't draw it very well, and you don't have anything in here to support, you have this empty area, the pressure of the entire body, and you've got a lot of weight, especially when you're walking. You have all your weight on one foot, and then you take a step and all the weight's on the other foot. That's a lot of weight to put on this arch. And all the pressure is in two spots. The heads of the metatarsal, what we call the metatarsal heads, and the tip of the calcaneus down it. Now, if you think about my hand as my foot, and here's my leg coming down, and here's my ankle. Here's the heel, here are the toes, I'll turn around. Every time you step, if you have shoes on, remember the heel cannot go backwards because it's stuck in the back of the shoe. So what happens is, because you've got this arch, it sort of gives you a spring, but it stretches the toes forward. That, by the way, is also part of the reason we get bunions, which I'll talk about in another topic. And it stretches, and you notice that if this area right here, this fascia that connects the two bones, it stretches and it kind of rips at it. Because right along the bottom is this connective tissue called the plantar fascia. Plantar means bottom of the foot, and fascia is that connective tissue, that canvas. And it's kind of like a bow and arrow. You've got the bow, and it's brought down into tension by the bowstring, right, that you pull when you shoot a bow and arrow. That would be straight, but this string pulls it together. But the bow stretches, it pulls on that string. In the same way, whenever you step, it tends to push that part forward, and that pulls on the plantar fascia. And it kind of, every step, it kind of pulls at it, pulls at it. Well, this is living tissue. And after a while, it gets kind of beaten up, and it gets sore. Now, how many toes do we have? 5, typically. How many heels do we have? 1. So that fascia goes from the one heel to all 5 toes, or metatarsal heads. So it spreads the stress out in the front part of the foot, but it all comes to one focal spot in the back. And that one area at the calcaneus, at the heel, takes all of the same pressure that 5 metatarsal heads do here. And so this tends to be right underneath the bottom of the heel. That tends to be where you get plantar fasciitis, inflammation of the plantar fascia. And it gets sore. And the more you walk on it, the more sore it gets. Now, it's ironically, when you rest it at night, it actually can make it really bad in the morning. Why? It's because when your natural resting, here again is my foot, here's my leg, and here's my ankle, and here's my foot with the toes and the heel. At night, your foot tends to do this. We call that the equinus position. Equinus means horse. A horse's hooves actually are the toes, and the ankle is way up top, and the back of the foot, the heel, is way up in the air. They don't have a foot like we do. They stand on their tiptoes. So your foot, if you think about it, when you lay down in bed, whether you're on your stomach or your back or your side, your foot tends to go down in the toes out position. We call the equinus position. What happens to the plantar fascia? Imagine this in your mind. When you do this, it tends to shorten. the toes and the heel come a little bit closer together. So as that plantar fascia tries to recover all night and rest, it tends to contract because, of course, it's shortened. And so when you take your first step in the morning, rip. And that's why when you get up in the morning with plantar fascia, it's so doggone painful because you're tearing that plantar fascia. It's like having low back pain, and then you rested all night and you get up in the morning, and the first thing you do is you do a deep knee, lean way over and lift up. That's going to hurt your back right away. Take it easy on your back when you get out of bed. In the same way with plantar fascia, when you get up in the morning, kind of slowly tease that foot out, kind of stretch it gently. Even if you have to go to the bathroom or something like that, take the time to stretch it out so that it cannot rip when you first take your first steps. They also have different things like the Strasbourg sock, where you actually can sleep all night with this sort of tethered area, the tethered sock that goes up to your knee and sort of holds your foot up like this all night so it doesn't do that contracting. But that's what plantar fasciitis is. And you treat it with stretching, you treat it with rest, and how do you prevent it from coming back, or maybe treat it so it goes away in the first place? Get rid of the isolated pressure here. We want support all the way across the foot with a nice, good arch support that fills that gap and spreads out the pressure so you don't get all of this pressure here, pressure there with the stretching of the foot. You need that support. That helps prevent it from coming back and oftentimes helps it to go away. Now, plantar fasciitis, what about in our own lives? How many times in our own lives do we have areas, the chronic area that gets all the abuse, and we don't get any support? We're the only one who does it. We do it over and over and over again, and we just consider ourselves, maybe selfishly, maybe just generously, to be the one person who can do that. And so we don't get any support for all the other areas in our lives, and this just causes chronic inflammation and pain. And unless we put support in our Christian lives and get help, this is never going to go away. We have to get support. We cannot be the lone island who just does it all by ourselves. Who's the pastor to the pastors? Who's the parent to the parents? Who's the helper to the helpers? Are we willing to allow people to come into our lives and help us? Because we need it too. That's my encouragement to you, is get that arch support in your foot for plantar fasciitis. Get that spiritual support in your life, because without it, we're going to end up having areas of our lives that get used and beaten up, and they're going to cause us problems every time we try to walk our Christian walk. This is Dr. Keith McAfee. Thank you for listening. I look forward to talking to you again soon. I hope you enjoyed this video. If you would like to see other such video logs, please go to my website, KeithMcAfee.com. There you'll also learn about my book, Breathe, A Physician's Stories and Reflections on Prayer, published by Westbow Press, a series of 45 true stories from a medical career, and how that relates to our prayer life. Thank you very much for listening. I look forward to talking to you again soon.